think it's something that's been underestimated in the past, but if you look for problems in the lower respiratory tract, you will very often find them, and patients may not be aware of the fact that their lungs are also affected in these diseases that mainly present in the nose and sinuses. There are a whole raft of ways in which you can look for inflammation. One of the ways that we look for it is to look at expired nitric oxide. This gas is produced naturally in the respiratory tract. Highest levels actually come out of the nose and sinuses and from the sinuses. And it's something that the chest physicians don't always look for in the nose and sinuses. But if we see a patient who's got inflammation, then their expired nitric oxide levels will be raised, and that will give us a clue as to what's going on lower down. Well, we know that there is an interrelationship between the upper and the lower respiratory tract. So in patients who are asthmatic, there is a higher incidence of rhinitis, both allergic and non-allergic. If you challenge the lungs in an asthmatic patient, you can demonstrate reactions in the nose. And with patients who are asthmatic, and particularly those who have aspirin sensitivity, there's a much higher incidence of patients with nasal polyps. The evidence is not very strong in the sense that it's difficult to do randomised placebo-controlled trials when you're doing surgical procedures, but there have been a number of prospective cohort studies and also some randomised studies where the patients have been randomised to either medical or surgical treatment, and all of them have shown improvement in the subjective symptoms such as chest scores, also in measurements such as hospitalisation and use of medications, and in some of the studies also in the liver function tests, which have shown improvement after surgery.